So major work streams. You know, just to summarize, the four things that we focus on and really you know, try and tackle all the time or think of all the time are in our policy to combat this is testing, building our capacity to test, and then communicating with people, having a hotline, 24/7 hotline to answer people's questions, media campaigns, contact tracing, which is very important. Any case that gets detected we contact everybody that was in touch with this case. We go after them, we test them, we isolate them, we make sure that clusters are built. And one of the things that we just launched recently is an app where you download this app and you make sure that your location is inputted in the or you allow it access to your location. And then if I was positive or in isolation, the public health officials will put that in the app, in the system. So if you come across anyone who is positive, it would tell you that you came close to someone positive, go get tested. And
wow,
we're disseminating information through this app. We're giving people, you know, information to read in the app. And then recently we got a bracelet that is kept in someone's rest. So if you're in home isolation, you get that bracelet, it's linked to the app. And then if you leave your house or you go 10 meters away from your phone or some distance from your phone, it sends an alert to public health.
Wow.
Because it's thinking of when we have more cases than the capacity that we have to isolate people, we will have to tell people stay at home. But at the same time, we want to make sure that people are not a risk to the society. So this is part of the preparation for the next phase. So we always kind of try and be ready for the coming phase. Always try to be ready for the coming phase. Medical facilities and making sure the medical facilities are ready is one of the important work streams. And then supplies and people is the fourth major work streams. We still are suffering like everyone else in the world in finding and sourcing protective gear, ventilators, and medicines. So it's and medical staff to make sure that we have the right medical staff. Those are the challenges that we're facing like anyone else in the world. And I'll show you how we're trying to tackle that, or the numbers that we're following. So here is where we are today. This graph shows the new cases per day, the discharge cases, the deaths, total confirmed, active cases, and total discharge. As you can see, the spikes are those, and they are either related to a cluster. So those are two clusters. So basically people who fall through the system didn't adhere to social distancing. They mixed with a group of people, and when you catch a tip of the cluster, you go out after the contact tracing, you see the severity of the cluster. So this is what you want to avoid. You want to avoid people falling through the system.
Was one of those a funeral?
Yeah, tell me.
Was one of those a funeral?
Yes.
Okay.
Yes, this one. Yes. So someone was came from Iran. We didn't detect the person, went to a funeral and shook hands with everybody, and then just spread it. And we found in one day 45 cases related to that in one day, and then a lot of cases in the following days were related to the same group. And then the other spikes are usually coming from abroad, and those are the flights that we get from Iran, and recently also we started getting, you know, people coming from Europe. In one flight recently, we had about 19 people coming from London. positive in the same flight. And the challenge here is when you have a positive case in a flight, it's so disruptive to the entire system, because then you have to ground all the staff, you have to isolate them for 14 days. The airline just get paralyzed because of that. So the impact is not only on the medical staff, it's also on anyone who got in contact. And airlines rely a lot on the crew. And if you have a flight coming from London with 10 or 14 or 15 crew members on the flight, all being grounded, that's just devastating for the airline. At some point, some airlines had 100 people or 150 people on quarantine at once. So this is something that is very important to think of, that the impact is not only on the medical system, it can spread to other parts of the system. The important line in here is the green line as well, which shows the number of recovery cases. And you need to make sure that this line is following this trend line. So those are the total cases, and this is the recovery line. They need to match. When you have a spike in the total cases, your recovery line is flat. Usually it will be flat. It's when you have pressure on your system, because it means more people on beds. So those are the important numbers that we keep following. We had, unfortunately, 4 deaths that people reported and we caught as COVID positives, and they were in hospitals. We had 1 death of a person who did not report. She passed away at home, and then when she was tested, we detected that she was COVID positive. So that is devastating. It's very it's why this thing is dangerous. Some figures very quickly. We've got 55% recovery rate. Death rate is 0.7% so far. Countries are starting to monitor the death rate now, not the number of active cases, because that's the indicator of the impact of this on your society. Hospital stay median is 10 days. People stay in hospitals for 10 days, the positive cases. Patients on treatment are usually 12%. So around 85% or 88% of your patients are actually not on treatment. They just need to be isolated. So that's the good news. Patients with symptoms are only 8%. That's the dangerous part of this thing. You would have people who are positive but they don't have symptoms, and they're spreading it in society. That's why social distancing is very important. And testing. So we're one of the highest countries to test per capita in the world. We've done around 35,000 tests so far, and we have 21,000 per 1 million persons. We're lucky to be small, and we can test more people easily, but testing is very important, and hopefully as more companies start to launch easier and quicker testing kits, the easier it becomes for people to test. But it's very important to detect the cases and isolate them. This just shows the number of tests per day. We've been going at the rate of around 500 per day, and then we went up to 2,000 per day. There was a quiet period in here because we just blocked flights and stopped people from coming into the country, almost, apart from very limited number of flights. And people around the world, to not travel. So there's a major disruption to the travel industry in here. And then we just launched an aggressive local testing capacity yesterday. And as you can see, yesterday we had the highest tests per day And we're just going to continue to test more people as we go. So that's the next phase: test more people, try and detect it and isolate. It's important to say, you know, we have more females than males. In other countries, it's more males, but in Bahrain, for some reason, it's more females. We're analyzing this data. I don't have an explanation for it, but we're gathering all the data that we can to just start to study it and try and understand this disease. The breakdown of cases per age, as you can see, it peaks at the 20 to 40 years old. Same for active cases. The good news is that you have a lot of people above 50 being discharged and recover from this. So this is the good news. But people are still analyzing the impact of this and who are at most risk of it. Is it people with cardiovascular disease, or people who have diabetes, or people who have other medical issues? Capacity at treatment facilities, as you can see, is good, and we keep monitoring that all the time. As soon as it starts to get close, we expand and try and split it so that you don't have pressure on one facility. This is something new. People in the private sector started to see an opportunity. You have people who are coming from high-risk countries. They're negative. They don't want to mix with their families at home to follow the 14 days home isolation. So we licensed 3 negative hotels. So if you come from a high-risk country, you have to stay at home for 14 days. You don't want to go stay at home with your parents or with your wife and kids or with your family. You can take a hotel room and stay in a facility that has a doctor and a few nurses, and you just stay there for 14 days and pay for it. So that helps also with all the empty hotels that we have in town now, given the situation. And we licensed the 3 negative hotels and 1 positive hotel. And the positive hotel, it's like a hospital. So they have doctors and nurses to treat asymptomatic patients. And the important thing is, for all 4 hotels, admission does not happen at the reception like any other hotel. You have to call the national hotline and get checked by public health, and then admitted by public health. So you control also who goes in. It's not an anyone check-in elite service. No, it has to be monitored by public health. You need to be going there because you need to be quarantined and you're negative or you're positive. The other thing also is we have a lot of people who are visitors to Bahrain. They don't have homes in Bahrain, and you don't want them to mix in regular hotels. So those people are starting to get booked into this hotel. So they're, for example, people who come from Europe and wanting to go to their country through Bahrain, and they have to stay in for 14 days before they can get into their country. So that's another opportunity that this created for us. This shows travel history of people coming from. It's just to say that the majority of our cases in Bahrain are coming from abroad. I'd assume that's the case for most countries in this region. But the number of local cases is also increasing, and those are mainly contacts of people who came from abroad. And then as soon as you lose, the contact of who is getting the virus from, that's when you have the local